All right, welcome back, everybody. I think we'll get going with our sort of didactic portion, but I hope everybody's feeling well and had a good experience. It's very interesting to see the shift in everybody before and after your acupuncture treatments. It's really very interesting from this standpoint also to do. So I hope that was a good experience for you all. So I'm Dr. David Miller, and I wanted to speak to you today about sort of the scope of the opioid crisis and why we're advocating for acupuncture as a key piece of the solution to that opioid crisis. And we have 4 speakers today. Dr. Jun Xu will speak after me on what's being done with acupuncture in China today to give you a sense of how this has already been integrated into their healthcare system, actually for many years. So it's not a task that's hard to do or impossible to do. In fact, it's already been done, and we can copy if we need to. Dr. Arthur Fan is going to speak to you about the educational standards for practitioners coming out of China, because they go through a different educational system, but it's a very strong education, and we want you to know what their practitioners learn. And Dr. Tracy Soltis is going to speak about the training for licensed acupuncturists in the United States, so that when you're choosing a practitioner, she'll give you an idea of what to look for and why choosing a licensed acupuncturist makes a lot of sense, as the training is impressive. So to start just looking at the scope of the problem, more than a third of Americans report pain, right? So 25.3 million Americans suffered chronic pain, and 126 million American adults reported some type of pain. So that's a third of the population is reporting this. And so the scope of the problem, something has to be done. It's a chronic condition. It's a chronic state of being human that we have pain. How are we going to manage that pain in the safest and most cost-effective way possible? So up till now, and increasing over the past decade, opioids have become the go-to solution. And there's a number of reasons why that happened. Some misunderstandings about the safety profile of opioids was a big portion of that. But nonetheless, doctors were prescribing more and more opioids, and patients were getting more and more addicted. 80 to 94% of patients undergoing low-risk surgical procedures would fill a prescription for opioids within 7 days, right? Not necessary. There are other ways to control that pain. So instead of getting relief, our population is getting actually deaths. So more than 33,000 Americans died in 2015 from opioid drugs, and more than 64,000 died in 2016. The human burden of this epidemic is profound, and we heard from Terry earlier about that, and it's almost unfathomable that more people will die from opioids or have died from opioids than they died in the Vietnam War. So just a phenomenal burden on the population. So because of this, of course, August 31st was declared Overdose Awareness Day, and the president also recently declared the opioid epidemic a public health emergency. I thought this graphic was quite interesting. So opioids are expensive. They're expensive emotionally, cost of human life, quality of life. But this is looking at where the most opioids are prescribed, coupled with the loss to the job force. So when we think about the economic burden of opioids, right, people are not taking their opioids and going to work and working well because they're not in pain. What's happening is they're getting addicted to opioids and they're dropping out of the workforce, and then we have to support these people out of the workforce as well as try to help them get better if we even can. So the economic burden of this is estimated to have been $78.5 billion in 2016. So I often hear that, well, it's a lot to add acupuncture to people's treatment plans, it's too expensive, how can we do that? We cannot afford not to do this. It's way less than $78.5 billion to incorporate this therapy into care. The attorneys general just put out a statement urging insurance companies to improve coverage for opioids, which is unprecedented. And a very large number of these professionals banded together to make this request. And this is really what we need. We need people from Congress. We need the attorneys general. We need physicians and hospitals, everybody saying we have to change our protocols. We have to change our infrastructure to be able to incorporate non-pharmacologic methods of pain control. And acupuncture stands as a shining star of one of the things that needs to be included in order to achieve that goal. So why acupuncture? Why does acupuncture stand out? There are a number of reasons physiologically that acupuncture stands out. I'm not going to give you a lecture on the physiology today, but acupuncture causes the release of endogenous opioids. It helps to modulate pain perception and thresholds, and it helps to change the way we process our physical experience. And it has been effective. And I want to show you that there is some good data to show that. There's a very large study of 454,920 patients, and looking at their use of acupuncture for a number of very common conditions: back pain, neck pain, shoulder pain, chronic headache, osteoarthritis. Right? And so they treated these people with acupuncture and surveyed their physicians to see what the physicians thought. Did they think the acupuncture made a difference in their care? And 76% of physicians said, yes, this seemed to be effective for my patient. They got better. It was a meaningful component of their getting better. A systematic review and meta-analysis, which is sort of the highest form of evidence that we can gather, looking at acupuncture for sciatica pain, another super common type of pain that many of us will experience throughout our lifespan, or at least at times, that acupuncture was superior to standard pharmaceutical care, pharmacologic care, in reducing both the intensity of the pain and patients' tolerance of pain, their pain threshold. Acupuncture was second in global effect only to biologic agents in another study, superior to all other interventions, including non-opioid and opioid medications. In plantar heel pain, also, an everyday kind of pain, acupuncture was found to be comparable to standard care. And so that's important to recognize too. When you're choosing how to treat a specific condition, you have options on how to treat them. And you want to treat based on what's safest, what's most cost effective, and also what connects with the patient. Patients have to connect with their treatment, or they won't follow through with their treatment. And if you can't follow through with your treatment, you don't get better. So we have options. So acupuncture shows that it could stand up and be an equal player in the options that patients have, and be equally comparable in its effectiveness. Interestingly, too, as well, sometimes opioids are needed. Sometimes they're the right choice for pain control. But then if they're going to be the right choice, we need to minimize the amount of opioids we're going to use. So you don't have to use opioids in isolation. They did a recent study in JAMA Surgery and found that that acupuncture was useful as a non-pharmacologic treatment in reducing pain after knee replacement surgery. So they looked at 39 randomized clinical trials, 2,391 patients, and they found that electroacupuncture electrotherapy reduced the use of opioids and delayed opioid use as well. So they were still getting the opioids, but they didn't need them as quickly, they didn't need them as much, and so they were able to lower the burden, which lowers the risk of addiction. So a similar kind of study, too, showed that acupuncture integrated in the emergency department, looking at acupuncture versus morphine to treat pain in patients appearing in the emergency department, that acupuncture provided more effective and faster analgesia than morphine and was better tolerated. So they looked at 300 patients, 150 patients in each group. Minor adverse effects in the acupuncture group compared to the morphine group too, which is not surprising. Acupuncture is extremely safe, which we'll talk about shortly. So there's some interesting studies that have done looking at the need for opioids after surgery. Some studies have reported reduced consumption by as much as 60% after surgery when you use acupuncture. And there have been some phenomenal studies coming out of the military too. How do we treat our military personnel, both active and veteran? And one of these studies showed that acupuncture dramatically decreased the use of opioids. We saw opioid prescriptions decrease by 45%, muscle relaxants decreased by 34%, and NSAIDs decreased by 42%. So quality of life measures also improved. So that's the other component of acupuncture that's so important to remember, is it's decreasing the pain, it's helping the patients get better, but it's also causing some global improvements in the patient's health. And you don't see that when you give pain medication, right? You don't see their mood get better necessarily when you give pain medication. You don't see their digestion improve, their menstrual cramps go away, whatever it is. Acupuncture does has a synergistic effect on multiple systems at once, and so you see more global improvements. So is acupuncture cost effective? And the answer is, when good studies are done, it does appear that acupuncture is cost effective. It's not going to be, the perfect choice for every condition, but for pain conditions and for a number of other conditions, the more we look at it, the more we say, wow, acupuncture actually really could save us tremendous money. Acupuncture was noted to save $35,000, $32,000, $9,000, and $4,000 for migraine, angina, osteoarthritis, and carpal tunnel syndrome, respectively. So that's a big savings in terms of care. And an interesting study coming out of Massachusetts showed that insurance coverage for acupuncture would only increase an average insured member's monthly health insurance by somewhere between 38 cents and 76 cents. So it's not expensive relative to what we're doing, because we have to remember that when we perform acupuncture, we're not doing something else, and that something else is often much more costly, right? So the average savings ends up being quite great. Looking back at that study with the 454,000 patients looking at acupuncture safety, only minor adverse events were reported in 7.9% of the patients, and only 0.003%, 13 patients out of 454,000 had severe adverse events, and some of those were also not entirely severe. So hypertensive crisis, and asthma attack, aggravation of suicidal thoughts, sort of odd things that it's hard to tell if it was causal or not, but also things that can be managed. The patients didn't die from acupuncture. Nobody dies from acupuncture, performed correctly by a properly trained individual. And that's an important thing to remember. So can acupuncture also help treat addiction? What about when someone's already addicted to opioids? So as far back as 1978, it was demonstrated that acupuncture decreased markers that we could measure, markers of stress, in heroin addicts compared to observational controls, compared to people not addicted, or people addicted not getting treatment, to be correct. And that's a really important thing to note too, because we have a group of people who are already suffering from opioid addiction, and how are we going to help get them off? We heard Terry's compelling story earlier about how maybe that could have been a part of her son's treatment plan, so that that he had some options, and he even reported that he found it helpful and then didn't have access to it, which is criminal, really, I think, at this point, when we look at the evidence and we look at our knowledge base and the accessibility and availability of acupuncture. In 2014, there was another study demonstrating that acupuncture decreased the amount of morphine used by addicts in treatment and simultaneously improved their sleep. So they got better sleep and needed less morphine. So acupuncture also may be able to treat addiction through a number of methods. There was a meta-analysis of studies done in 2012 concluding that the majority of studies did agree on the efficacy of acupuncture as a strategy to treat opiate addiction, and that they looked at different neurochemical and behavioral evidence looking at how it might be affecting key portions of the brain involved with emotional processing and addiction. Mesolimbic dopamine neurons were affected by acupuncture. Acupuncture also changed the balance of GABA, which is a calming, soothing type of neurotransmitter that makes us feel like everything's okay. So I just want to take a moment too, and we're focusing on pain. We're focusing on pain because we're focusing on opiates, but pain is a symptom of many things, and the goal is not to just treat people's superficial pain, right? Pain is what we would call the branch in Chinese medicine rather than the root. And so I want to emphasize that there's very good evidence showing that acupuncture can also treat the root of some of these conditions, so that people don't go back into pain, and so that you don't need to treat pain again at all. So finding evidence for even treating things like allergies, side effects of chemotherapy, headaches, some things, post-operative pain, but also a whole host of things like dry eyes, hypertension, and insomnia, irritable bowel syndrome, things like that too. We want to be thinking of acupuncture as an option. So acupuncture is available, and I think we should also be thinking this as a source of jobs creation, of economic development. We have a workforce of approximately 34,400 right now of trained acupuncturists in the United States, with an infrastructure in place to train many more quite quickly if needs be. They have to go through the whole program, which is a multi-year program, but the infrastructure is already there. We can direct them into that infrastructure if there are jobs for them on the other side. If we have sensible reimbursement and fair reimbursement for these individuals, then more people will choose this as a career path, and it will become more available. The other panelists today will be talking to you about some of that infrastructure, both here and in China, and what that looks like, so you can get an understanding of the quality of the education and the certification testing to assure competence. So while we look at this complex problem, we want to recognize, and the acupuncture community really recognizes too, that acupuncture is not the only solution. You're not just going to give people a couple of acupuncture treatments and solve the opioid epidemic. We understand that this is a team effort that needs to be made, and we need to all be working together to do that and use all of our mechanisms. But we have this tool at our hand, and we're not utilizing it, and we could be utilizing it right now, and we could be utilizing it much more. So we'd like to urge that acupuncture really be incorporated into medical systems so that it can become available to patients, so that we can avoid tragic outcomes and treat people who are already suffering. So if you have more questions about this, Dr. Callie Guymond can be our contact person for that, and you can also contact me, and we'll make sure that you get any information that you need. There's been a recently published white paper as well on acupuncture's role in solving the opioid epidemic, and this is available online. It is referenced, so if you search for it, you'll be able to find the article, and it's an open access article too, so you can download that and take a look at that. So with that, I'm going to conclude my portion of the presentation, and I'm going to ask Dr. Xu to come up and tell us about the status of acupuncture in China today. I'm just going to get your slide set up. So Dr. Xu, if you'd like to join us.
I'm so honored to have a speak over here. So one day, one of my secretaries just didn't show up in the work. So we called her. Her name is called Madeline. So we called her, but she just no answer. So we say, what's going on? Then wait until we started at 8:30. So until like 11, there's no response. Then afternoon, she called. She said, my boyfriend died on the bed because her boyfriend just released from methadone program for 1 week. Then he overdosed again, so died on the bed. She has 3 children. So this is a big disaster to her and to her family, and also to us, because of this problem. She just every day she's like, she cannot focus on her work. But I don't like to dismiss her, fire her. So that's the big headache to everybody, to this entire society. So I was wondering, because I was trained in China, so I'm licensed in both China and the United States for MD and also acupuncturist. I was thinking, what's going on? Why this happened? So when I remember when I was in China, we never prescribed opioid to patients. If they have pain, they have knee pain, we treat the cause of the pain. And if a patient don't have knee pain, we tell the patient to prevent it, how to do the prevention. So then I started looking for the Chinese system. Why the Chinese people don't use opioid? So that's why I cannot find the statistics of Chinese patient, how many people died of opioid. I cannot find it, so I'm sorry. So let's see the striking difference in the healthcare between the US and China. So look at this, the birth rate and everything, the hospital bed China is a little bit worse than US. However, we look at the life expectancy. China is 75.04 and the United States is 78.64. And the physicians, China has a little bit less physician, but US is not a lot more physician per 1,000 patients. However, for the expense, China only spend 5.5% of GDP. However, United States spend 17.1. And the healthcare per capita, Chinese only spend $731, and the US spend $9,403. So we can see the difference. We put so much money in, but we do not get much return. And so I just wondering why China is doing better than we are. So the Chinese government, for the healthcare administration, they have 3 different organizations, the government branch to handle this. Number 1 is the Commission of Health and Family Planning. And the number 2 is the state FDA, and number 3 is the State Association of TCM. the state administration, this should be administration of TCM. So they oversee about 34 provincial TCM bureau and 42 TCM university. So with 661,000 registered students. So David one time discussed with me, do you believe China has so many TCM students? I said, that's true, because even my school is like 15,000 to 20,000 students in one TCM school. So that's why we have 42 TCM universities and the colleges. We have 661,000 students. And also we have like 81 research institute. I say we, I'm sorry, just I was Chinese. And so we have 81 research institutes, then 22,000 scientists from the Chinese medicine and Chinese herb. We also did a lot of good research. So recently, Dr. Tu got the Nobel Prize because of the Chinese herb research. So that's. Then we can see the hospital and the physicians in China. So general hospital, there's 29,000 total hospitals, and the physicians is about like 2 million. However, in those hospitals, there's independent TCM hospitals. They have 3,966 hospitals, and the total physicians is 264,000 physicians. So and also in the general hospitals, the Chinese hospitals also include a lot Chinese TCM physician. So we can see the difference. So in the general hospital, basically in the United States, we don't have TCM practitioner at all. And we have some, in the United States, we have some clinics, but it only just recently, and also we have individual practitioner for acupuncture. So let's see the TCM hospital admissions in China, and this number. So from 2005, the general hospital is 41 million, and the TCM hospital had like 6 million admissions, this 2005, and this tendency is going up. See, 2012, the general hospital had 99 million, and the TCM hospital has like 17 million of admissions. So in China, the TCM hospital admissions, they are doing the same treatment as the general hospitals. They also take a heart attack patients, take care of the total knee replacement, but they combined with TCM procedures, I mean traditional Chinese medicine procedures, including acupuncture. So in this one, we can see the difference. Chinese government already integrated the traditional Chinese medicine into their medical system. So, and also the Chinese, they are learning our United States healthcare system, but I think they put, before so they cover everybody, the government cover everybody. But now they have commercial insurance, like we have Aetna, Anthem, all this. Now they also have the government, but basically they also cover TCM procedures. So TCM research, I just mentioned, so there's total 81 national run and the provincial run, the city run, the research institute. So they have a total employee, so like 22,000, and the scientist is 12,000. So they are doing a very good job, a very good research to help development of the TCM. So how does traditional TCM help and save money? So that's the key issue. So we like to help, but how? Just TCM just focus on lifestyle and to prevent disease. So that's the key. So if the patient they get obese, so we have to reduce their obesity and lose weight, then they will not have knee osteoarthritis. So, but we in the United States, generally we don't focus on that. We treat the patient when they get and also we are. As a physician, I'm a physician here, so we are motivated by the procedure because the procedure makes more money. So if a patient just come to me, I just tell him, hey, you have to lose weight. I give you the program to lose weight. That will not, I don't get paid. I just paid very minimum, like office visit, maybe paid at $50, $60. But if I do the cortisone shot to the knee, I will be paid about like $400. So you see the difference? So that's why the physician focus on procedures. We don't focus on lifestyle changes. We don't teach the patients to change their lifestyle, change their to do the prevention, and also. So how to do the prevention? We just teach the patients exercise like Tai Chi, Qigong, and also food therapy. So we tell the patient, not only tell them how to reduce the cholesterol, so we also have a lot of different kind of herbs to teach the patient. You take the herb, your cholesterol will reduce, and your lifestyle should change, blah, blah. So we are focused on prevention. TCM focus on prevention. And how to do it? So what is traditional Chinese medicine? So let's see the first slide on the left side, on the left corner, that's the Chinese herb. So generally speaking, TCM has like about 200 herbs. So we can use, we generally routinely use 200 to 300. And also the acupuncture. Acupuncture is one of the key treatments in the United States and in China. So we use acupuncture because there's no side effects, so this then get a lot of popularity in the United States and in China, and also massage, and also the cupping. On the left lower, we know Michael Phelps use cupping. So that's the cupping we use. So all this natural treatment and the massage, and also the last is the heating lamp. So all this tells us. So we use a natural way to treat the patient. We do not have much side effects. I can say much, just a little bit side effects. If you use herb, might, but if you are experienced, usually there's no side effects. So my final words, so TCM has been officially integrated into Chinese healthcare system for more than 50 years, and is playing an increasingly important role. So I think the United States government and the leaders, national leaders, should think about this, to use this natural treatment to help the patient reduce pain. And also acupuncture is one of the key treatment methods. And TCM focus on prevention and treat its root cause. So we treat what's caused it. We do not focus on procedure. So that's very important. And also United States should learn from Chinese government, at least for this part, just how to reduce the treatment, how to reduce the cost, and how to make the patient feel better and more healthy. And TCM is cost effective. So that's my presentation. Thank you so much.
Thank you, Dr. Shi. I'd like to invite Dr. Fan up now to speak to us about what it takes to become a trained practitioner in China.
Yeah, hi, how are you, everyone? I'm Arthur Fan. So many people think acupuncture is a Chinese style therapy. Yes. So so many people think of how China train the acupuncture. So how about the acupuncturist, the education in China? So the official name of acupuncturist in China is MD in the Chinese medicine, or we call the MD in the TCM, traditional Chinese medicine. So a few years ago, in 2000, there are 264,000 MD in the Chinese medicine in China. So Dr. Xu already discussed how many Chinese medicine hospital. So up to now is about 4,000 Chinese medicine hospital. And 446 is integrative style. And also have TCM clinics, government approved and also supported. So it's 42,000, and also integrative style the clinics 7,700. So each year, the patient sees the TCM, the doctor, 910 million patient each year. And the inpatient, stay in hospital is around 21 million each year. So the acupuncturist in China is called Zhongyi, Chinese medicine doctor, is MD level. So the acupuncturist education in China, the educational institute is 42 universities. So this university not only teach the TCM, they may have other. So for example, Nanjing University of Chinese Medicine I attend now is very huge, including around 20,000 students, and also have around 10 college. So including one college in the Chinese medicine, including another one in the American style MD college, and also have other law school and pharmacology school. Besides that, and the other school, Western Medicine University also have about 200 additional the TCM training in short form or like assistant level or like integrative style. So the education in the TCM university is 4 to 6 years school and add additional 1 year internship. So about 40% in the Chinese medicine. This is a little bit mistake. Around 40% in the conventional medicine, 60% in the Chinese medicine. So after you graduate, the school offer the degree of bachelor or master in medicine, equivalent to here's MD level. So the United States, the AMA, and also internationally, the WHO accept this style education as an MD level. Some of TCM doctor actually initially were trained in the conventional MD school, not the TCM. So after a few additional years of training, they become the TCM doctors. So after you graduate, if this student accepted in a school, so it started 6-year residency. So this is very similar to USA, but USA treat these people as a trainee. In China, there's already employee. So this is different. Then after that, you have a specialty. Okay, so some of other doctor have additional training in another hospital focus on the specialty in the conventional medicine, for example, neurology, or training in abroad. Also have some additional doctor trained in master and PhD. So this is 42 school, not only in Chinese medicine, so they have huge student every year. So the school training in China actually already have 1400 years. So in Sui dynasty, so China already have medical school. So in the Emperor Academy of Medicine. So this is my talking about the education. Thank you.
Good. Thank you, Dr. Fan. I'll invite Tracy Soltis to come up and tell us about the training of acupuncturists in the United States now.
Bring that down to me a little bit. Thank you, Dr. Miller. Welcome, everybody. I hope you enjoyed your acupuncture treatment that you've just received. Today, I'll be speaking to you to help you to better understand the acupunctural educational training and qualifications of our nation's acupuncture professionals. The term acupuncture in the U.S. is used both to describe the use of thin, sterile filaments, which you just experienced, to affect change in the body, but as well, this term is used to describe a comprehensive, dynamic, and elegant healthcare system that encompasses a variety of traditional and modern East Asian healthcare therapies. In this broader definition of acupuncture, we understand the term to encompass a wide range of traditional and modern medical practices that integrate different types of treatments, including acupuncture, herbal medicine, bodywork, and manual therapies, which diagnose, treat, and prevent an extensive variety of illnesses and ailments, about some of which Dr. Miller just spoke. The National Certification Commission of Acupuncture and Oriental Medicine says that acupuncture, as this comprehensive system, has, quote, arguably one of the highest levels of sophistication with respect to integrative medical concepts. This assertion is made primarily based upon the emphasis during an acupuncturist medical training that is placed upon traditional diagnosis in conjunction with the requirement for participation with other healthcare providers in the broader medical marketplace. So, in other words, an acupuncturist must be trained to understand both his or her own trade, as well as how it relates to and translates into mainstream medical terminology and concepts. As a result, an acupuncturist training includes a robust amount of coursework specific to modern biomedical systems and concepts. As Dr. Miller noted, our most recent totals show that there are approximately 34,400 licensed, certified, or registered acupuncturists qualified to practice in the United States. The Accrediting Commission for Acupuncture and Oriental Medicine lists 56 independent institutions in 22 states, offering a total of 95 different accredited or candidacy status programs in the study of acupuncture and Oriental medicine. Enrollment in these programs over the last 9 years has remained between 7,000 and just over 8,000 students per year, with the schools having a capacity to accommodate even higher enrollment should the conventional medical institutions continue to increase gainful employment opportunities to providers in this important and unique healthcare field. One of the greatest barriers to actualizing the resources of this untapped workforce is the lack of understanding regarding the extensive training the acupuncturists undergo in order to qualify for licensure or their state equivalent. As scientific evidence continues to grow regarding the effectiveness of acupuncture, we're seeing a rise in the number of insurance companies that choose to include acupuncture as a health benefit, and more institutional settings such as hospitals, Veterans Affairs, even the Department of Defense are adding acupuncture as an optional treatment to both inpatient and outpatient care. But this availability is still in its infancy. Access to readily available, cost-effective acupuncture treatment is still the largest barrier for the patients that are in need of these services, and lack of sensible reimbursement mechanisms still stifle the growth of the field. Most health insurance plans continue with acupuncture limitations or exclusions from their health insurance packages, and there remains a lack of job opportunities for licensed acupuncturists in conventional medical institutions. We have a ready and ably trained workforce, but the patients can't access it because of these misunderstandings that perpetuate outdated restrictions, which then exclude services. While a growing handful of our allied health occupations may be permitted by individual state law to perform specific acupuncture protocols or shortened treatments under limited circumstances and with restrictions, the comprehensive field-specific training that a licensed acupuncturist receives renders them the experts on acupuncture and its practice in both historical and modern context. A licensed acupuncturist's extensive training and understanding of the full breadth and complexity of the system from which acupuncture emerged allows him or her to tailor protocols and individualized treatment to that which is going to best serve each patient's unique healthcare needs. Rather than diverting our existing medical professionals who are already providing valuable and much-needed healthcare services from their intended work, healthcare institutions could immediately be encouraged to bring on licensed acupuncturists who can work with the patient's physicians as a supportive member of the comprehensive care team. 47 of our nation's states, as well as the District of Columbia, formally regulate the practice of acupuncture by requiring the provider to become licensed, registered, or certified. The 3 remaining unregulated states, Alabama, Oklahoma, and South Dakota, have begun the process of codifying formal regulations into law, so we expect to see this number include all states in the coming years. The process to become a licensed acupuncturist begins with graduation from an accredited master's degree or certificate level program. The Accreditation Commission for Acupuncture and Oriental Medicine, or AACOM, is the national accrediting agency that's recognized by the U.S. Department of Education to accredit both master's and doctoral level programs in the field of acupuncture and East Asian medicine. There are 2 tracks for master's level degree programs. The minimum standards for these 2 entry-level programs can be seen here in the charts. We have the Master of Oriental Medicine, that's the MOM degree. It's a minimum 4-year, 2,625-hour program consisting of 705 hours of foundational Oriental medicine and acupuncture-specific theory. This includes East Asian medical theory, diagnosis, and treatment techniques in acupuncture. 450 hours of didactic herbal medicine studies, 510 hours of biomedicine-specific training, another 90 hours of counseling, communication, ethics, and practice management, and then at least 870 hours of acupuncture and herbal supervised clinical training. Some traditions of acupuncture do not include herbal medicine component, so you'll see here that our licensees may also complete a Master of Acupuncture degree with the same requirements in acupuncture theory, biomedicine, etc., but with 660 hours of supervised clinical training, however, without the added hours specific to herbal medicine. While these are the minimum educational standards required by AACOM, in actuality, many of our schools offering acupuncture training programs have a far more extensive program, offering between 2,200 and 2,400 hours for the Master of Acupuncture and 3,000 to 3,100 hours for the Master of Oriental Medicine program. In addition to the entry-level master degrees, the profession offers 2 distinct doctoral degrees. The postgraduate clinical doctorate was developed with a curriculum focused on specialization and advanced knowledge and skills. This AACOM-approved postgraduate degree is known as the Doctorate in Acupuncture and Oriental Medicine, DAOM, and it consists of a minimum 1,200 hours, 650 of which must be dedicated to advanced clinical training. Candidates of the DAOM must have completed the master degree program to be eligible for admission to the DAOM program. So these 1,200 hours are in addition to the 2,000 or more hours they've already completed in their master's degree. The second path to doctoral degree completion is the entry-level professional doctorate. ACOM has approved standards for an entry-level professional doctorate in acupuncture and a doctorate in Oriental medicine. So these two entry-level professional doctorates add an additional 300 hours of training onto the minimum requirements for the master's program, with a minimum of 790 hours of clinical training for the doctorate of acupuncture and 1,000 hours of clinical training for the doctorate of Oriental medicine. The professional doctorate coursework expands upon subjects such as patient care and advanced diagnosis, systems-based medicine and collaborative care systems, professional development, and an increased incorporation of scholarship and research focused on evidence-based medicine. These additional requirements prepare the graduate to integrate their skills into the conventional medical institutions and to be a fully supportive, collaborative member of the patient's current team of medical providers. Following this extensive educational and training process, acupuncturists then sit for their national certification. The National Certification Commission for Acupuncture and Oriental Medicine, NCCAOM, is the national organization that validates entry-level competence in the practice of acupuncture through professional certification. Its mission is to assure the safety and well-being of the public and to advance the professional practice of acupuncture and Oriental medicine by establishing and promoting national evidence-based standards of competence and credentialing. After an acupuncturist has completed their formal schooling via an accredited program or an approved apprenticeship, he or she may obtain national certification with NCCAOM by sitting for and passing 3 to 4 certification examinations, including acupuncture with point location, foundations of Oriental medicine, biomedicine, and Chinese herbology, as well as showing documentation of certain safety-related specific coursework such as clean needle technique or CPR. Acupuncturists who complete the NCCAOM certification process are referred to as diplomates of acupuncture or diplomates of Oriental medicine, depending on the certification path for which they have applied. NCCAOM certification serves as documentation of competency for licensure in 46 states and the District of Columbia. Currently, California is the only state that administers its own licensure examination, but in 2016, the California Acupuncture Board voted to require the NCCAOM exams as one of the prerequisites for licensure, and they will adopt these exams beginning as early as 2019. Certification is also required by many employers, insurance companies, and hospitals. It's considered a very prestigious professional achievement to earn the designation of diplomate from NCCAOM, as it indicates to employers, patients, and peers that one has met national standards for the safe and competent practice of acupuncture. NCCAOM reports that there are currently 17,600 active diplomates practicing worldwide, and in the last 35 years, the organization has certified 29,839 individuals. NCCAOM is a member of the Institute for Credentialing Excellence, and its certification programs are accredited by the National Commission for Certifying Agencies, that's NCCA, whose standards exceed the requirements set forth by the American Psychological Association and the United States Employment Opportunity Commission. In order for NCCAOM certification programs in acupuncture, Chinese herbology, and Oriental medicine to remain accredited by NCCA, the NCCAOM must adhere to strict national accreditation standards for administration of the certification program and examination development. All diplomate level certification exams must meet content validity standards that are set forth by NCCA. So to ensure that the certification exams are valid, NCCAOM conducts a job task analysis survey of the practitioners in the profession every 5 years, and revisions of examination questions are based upon the survey's results. This assures that the content of the exams accurately reflects advancements that are always happening in the profession, and that certification candidates are able to competently perform the tasks that the acupuncture practitioners that are already licensed are doing on the job. So this gives you a snapshot of the high level of education, training, and testing standards for acupuncture in the United States. This concludes our formal presentation,